Afternoon, Dr. Morse, injury expert. So we heard about a possible injury yesterday to the Vikings rookie quarterback, McCarthy. He had been dealing with knee soreness. Now, sometimes this is not a big deal. The knee can get a little bumps and bruises. You can get a little injury to the MCL, but sometimes it's more than that. He was dealing with swelling, probably a little bit of pain, maybe even a little bit of inflammation inside of the joint. And they said, okay, what's going on? Maybe he had some locking, maybe he had some catching, maybe he did a little bit of twisting and felt a little zinger either in his knee or down his leg. That usually correlates to a meniscal tear. They confirmed it today on MRI, and now the question is, what do they do about it? So the meniscus is this blue structure right here, and there's actually two of them. There's one on the inside of the knee, and there's one on the outside of the knee. This is what they're shaped like. So they can have this kind of C. It just depends on which side you're talking about. Now, they are anchored in the front, but they are really anchored in the back. And these are your cushions for your knee. So basically what they're trying to do is protect the articular cartilage or the protective layer on top of that bone, but also serve as a cushion. So whenever you plant and rotate or step on uneven surfaces like grass or sand or anything like that, your meniscus is doing the job. So what can happen is that meniscus is like this, and sometimes you can tear it where it literally will flip over or a piece of it will come up, and that looks like that. So you can also have a tear like this, you can have a tear like that, but most importantly, you can have a tear like that. Now that is called a bucket handle, and those are a big deal. Now, my suspicion is this is a small little flat tear, something like this, a little annoying piece that they're gonna go in and basically just trim out that. In the acute, short term, works great. It will remove that. They'll increase the stress on the surrounding meniscus because you just remove some of it, and you will increase the stress on the ACL, which is important to know. But if the meniscus is really torn and locking, or there's a big piece of meniscus that is there that is too big to trim out, like this one, the crazy one up here, they'll have to do a repair, which is exactly what it sounds like. They'll go in and they will basically suture that together. Now, the timeline between these two is significant. A trim, some guys come back in 2 to 4 weeks. For him being a rookie, I wouldn't be surprised if they put him on PUP and potentially didn't start him or activate him until after the week 6 bye. If this is a significant injury and a repair, there's a chance his rookie season is over before it started, because these usually take 3 months, sometimes closer to 4 or 5 months, just depending on the specific injury. And they are notorious for slow healing and re-injury because the meniscus does not heal well. That's why you have to address it in the first place. Not the best news, unfortunate news for this up-and-coming potential rookie. And now we are impacted by knowing that Darnold's definitely going to start the season, and he may be there the majority of the season. So it really just depends on how you feel about Darnold. I'm personally not a big fan of him, and I don't think he was going to last that long with McCarthy waiting in the wings, but that may delay this. And this is going to have an impact on Justin Jefferson. This is going to have an impact on Jordan Addison. This will also have an impact on the running game, either directly or indirectly. So many things to think about with this specific injury. It is not isolated. You might not have been targeting McCarthy, but that doesn't mean you're not targeting or indirectly affecting the other players around him, with him, you assuming that he was going to be ready. So this is one of two things. This is going to be, he'll probably be back early in the season, anywhere from week 2 to week 7, or this is going to be pretty much season ending. Hopefully it is of the milder variety and we get to see him play this season. If you found that helpful, do me a favor, follow me at Dr. Jesse Morse on Twitter or Instagram, and check us out at The Injury Experts on YouTube and some of our other platforms, including checking out our website. Thank you very much. Take care.